There are two kinds of hormones, hunger hormones and satiety hormones. When hunger hormone is high, you will feel hungry. When satiety hormone is high, you will not feel hungry. The corporate company have created a beautiful thing where they have cracked the code, have the people get addicted to this high fat, high sugar foods. So what happens is when you eat high fat, high sugar foods is that your hunger hormone is always on the higher side. When the patient listens to us and starts doing that, the patient will not have the cravings, will decrease their calorie intake, and the obesity will come back to normal. This is what has happened so far. Everybody wants quick fixes. The companies have created this drug. It will say that I'm going to paralyze your stomach.
Do we use a word as big as paralyze here? Is
Yes.
that what?
That's called gastroparesis. Gastro means stomach, paresis means paralysis. There are three kinds of drugs, Mounjaro, Ozempic, and there are other different. This is not a permanent solution.
So there would be a likely rebound.
There will be a rebound. There is no question of likely at all. There will definitely be a rebound.
What about people talking about can make you more prone to cancer?
Honest answer is we don't know. The side effect is a part and parcel of this. Many patients will not be able to tolerate the side effects.
Who will you not give this drug to ever?
Patient who will not willing to do this lifestyle medicine. You cannot tell a patient that, this is only my opinion. I don't think.
I'm waiting.
Yeah.
Welcome to the Exposome Effect once again. Today we have a guest who absolutely needs no introduction. So I'm just going to start right in with my questions. Welcome, Dr. Pal.
Thank you, Renita.
Let's start right off with the questions that everybody's been talking about. What is GLP? What is a GLP agonist? What exactly are these medications? Mounjaro, Ozempic. What are people talking about? What is injectable? What's a tablet? Tell us everything in a way that a 12th class student will understand.
Main reason that all these drugs are marketed is to treat the pandemic of obesity. So obesity, people should understand that more calorie intake, more than what you need, will get accumulated in your body that leads to obesity. Why is more calories being taken? Because of the hunger. Why are people hungry? Because they are not eating the right foods. When you eat fiber-rich foods, protein-rich foods, what happens is that there are two kinds of hormones, hunger hormones and satiety hormones. When hunger hormone is high, you will feel hungry. When satiety hormone is high, you will not feel hungry. So when you eat fiber-rich foods, protein-rich foods, your satiety hormones will go up and the hunger will come down. So what has happened in the last 15 years is the widespread availability of ultra-processed foods. And the corporate company have created a beautiful thing for them where they have cracked the code to how to have the people get addicted to this high-fat, high-sugar foods. So what happens is when you eat high-fat, high-sugar foods is that your hunger hormone is always on the higher side because you're bypassing the normal pathway and you are always stimulating the hunger hormone. So you're always feeling hungry and you're craving for all these foods. So then what happens? You take more calories. So then more calories than required, it gets converted into fat and your obesity comes through. Before these drugs were invented, we usually talk to patients and then say, see, listen, you need to eat properly, you need to have high protein, high fiber, and that is not an easy task. When the patient listens to us and starts doing that, then what happens is the hunger hormone goes down, satiety hormone comes up, and the patient will not have the cravings, will decrease their calorie intake, and the obesity will come back to normal. This is what has happened so far. But because we don't have the time, because of everybody wants quick fixes, the companies have created this drug where it will say that I'm going to paralyze your stomach, which means that when you eat, the food doesn't go from your stomach into your small intestine.
Do we use a word as big as paralyze here? Is
Yes,
that what happens?
yes, it exactly happens. That's what happens because it decreases the motility of your stomach. That's called gastroparesis. Gastro means stomach, paresis means paralysis. This drug is bound to create that effect, gastroparesis, paralysis of stomach. So when there is decreased motility, what will happen to the food? The food will be in the stomach. So when the food is in the stomach, what will be the hunger hormone do? Hunger is like, there is no need for me to be there. Then the satiety hormone is like, oh, okay, this guy is full. So he doesn't have to eat anything. So the patient will not feel hungry. Let's say they ate like 4 or 5 rotis before, they will not be able to eat more than 2 rotis. So the concept is, again, the hunger hormone goes down, satiety hormone comes up, the calorie intake goes down, the weight reduces. This is what happens. Okay, so these guys have created, this is a wonderful drug actually. Okay, there are 3 kinds of drugs: Mounjaro, Ozempic, and there are other different classes that is coming up as well. Most common is Ozempic and Mounjaro is what, Wegovy is another thing, but I don't think it is still there in market yet in India. Ozempic and Mounjaro, Ozempic was invented for diabetes. Okay, so what happens is when you decrease the calorie intake, sugar control also gets better, so diabetes gets better. So then they said that, okay, so when decreasing the calorie intake, sugar gets better, then the weight will also get better. So that's how Mounjaro was invented for weight loss, which is a double efficacy than Ozempic, where the hunger hormone is even more suppressed. This is the bottom line explanation without going into a detailed pathophysiology. The problem here is that this is not a permanent solution. This is a temporary solution.
A head start, if you will.
Head start, if you will, right? So what happens in chronic period of time, let's say like 3 months, 6 months, you take this medication, the stomach remains paralyzed. Okay, stomach remains paralyzed, and then they will lose weight. So I have had patients, the maximum weight you can lose is around like 20%. So let's say you start with 100 kilos. 20%, it will go down to 80 kilos. After that, there will not be that much amount of effect. So then what will happen? Okay, so I reach my 80 kilos, so let's take the drug out. When we stop the drug, then what happens? The motility is right back, and there is no paralysis of the stomach. Then the stomach contracts properly as it should. So then the hunger hormones gets right back into action.
So there would be a likely rebound.
There will be a rebound. There is no question of likely at all. There will definitely be a rebound. And multiple studies have shown that repeatedly. We know about this drug for the last 5 years. 5-year data is saying that no matter whichever patient it is, if you stop Mounjaro, if you stop Ozempic, if the underlying problem of the fiber, protein, diet, exercise is not being taken care of, that weight that he or she has lost will definitely come back. We have seen that. So what we usually do in our practice is that in California, where we start the patient on lifestyle practice first for a month. We will see whether this patient is able to do the lifestyle practices at least 25 to 50%. So they will know, okay, this is what I should do. Then the second month, we will start them on Mounjaro or Ozempic and continue that for 3 months or 4 months. Then they will decide the achieved effect. They achieve the desired effect, and in those 3 months, this lifestyle practice will also be there, where we increase your accountability. And the 5th month, we take the drug off. The lifestyle practice takes over.
Right.
This is exactly how it should happen.
You use it as a primer. Then possibly mitigate all of the problems that have happened with that overweight. The body's been living in an overweight compromise situation for a while. For example, it could be somebody that's developing arthritis because of excessive body weight, somebody who could be having a cardiometabolic risk because of that. You use this as a primer, because I think one of the things that motivates people the most is when they see results. So this could be something like a reinforcing effect, so that they enjoy the benefits of having lost weight. Meanwhile, we are building habits so that will see them through the long run. When I speak to patients, I hear as if they are going to be on this forever because it's a great place to be. So that's not possible. That's basis what we're hearing. That's not really recommended. So what do you see as problems in the short term? What do you see as problems in the long term when people can't get off? Is there something like people find it difficult to get off? Have you faced such circumstances?
Yes, let's talk about the short-term problems and long-term problems.
Yeah.
Okay, short-term problem is, again, people need to understand this term gastroparesis. Gastro means stomach, paresis means paralysis. This is what happens in patients with uncontrolled diabetes, as you know. When the A1C level is more than 7, because of the excess glucose levels, the nerve supply to the stomach gets paralyzed. So many diabetic patients will come to us, will say that I feel full, I cannot eat that much, I'm having nausea, patients throw up.
Paradoxical,
right? And then they have bloating. As soon as they eat something, they're bloating, and they will have constipation because there is no motility. So then we figure out that, okay, so I think these are all signs of gastroparesis. We do an endoscopy. We do a camera test that goes through the throat to look into the stomach. For the endoscopy, we say you should not eat or drink for 8 hours. The dinner should be around like 9 p.m. And then at least 8 hours should be the fasting, so that we can see the stomach completely, so it empties into the next part. When we do endoscopies for these patients, the food that they ate at dinner will still be there because the stomach is not contracting. Okay, we can clearly see all the undigested food will be there. And we have actually seen whole solid food still. We can actually see, okay, you ate turkey last night. The same effect that we are seeing in patients with Mounjaro and Ozempic. That is the scariest part. We are seeing what the patient ate the lunch the day before. That is how good the effect of the drug is. At the same time, that is how bad the symptoms would be. So they will have nausea, they will have bloating, they will have fullness, they will not feel hungry, they will have constipation, they will have abdominal pain, abdominal cramps, which means the drug is working.
Right.
Okay, so it is just a common mechanism. So many people start with a very low dose. For example, Mounjaro is an injectable. It is once a week. The half-life is so long that you just need once a week. You start with this low dose called 2.5 milligrams and you stay in for a while because all this is new to your body. So you have to adjust accordingly. We have to take it very slowly. And then you can go up to 5 milligrams, 7.5 milligrams, 10 milligrams. There will be a dose where you'll be seeing these effects. That is where you say, okay, so this is where my dose is, because that is where your hunger hormone is getting suppressed and satiety hormone is getting increased. So the side effect is a part and parcel of this. Most of the times it is tolerable, it is manageable.
It's like an expected process that happens and you are actually increasing the dose up until you reach this. So you're basically, it's not so much a side effect, but it's a process.
It's a process, right? It's a process.
What about side effects like, let's say the long-term side effects? What about people talking about can make you more prone to cancer, can give you a whole lot of other long-term complications? How do you look at
So one thing that we need to understand is it is a relatively new drug. Okay, so maximum data that we have is for like the last 5 years.
Yeah, and okay. That's minutes in medicine.
Correct. Okay, so long term, we're talking about like 10 years, 15 years. Honest answer is we don't know. And one thing I figured out is if it is medullary thyroid cancer, it is a strict no-no because we have figured out that this increases the risk of it. And if you have any other GI symptoms that you're not able to tolerate it, then we have to stop it. Okay, so these are all the things that we definitely know we shouldn't do. But the argument to that is, if the patient is not getting better in her diabetes, the glycemic control is not there, when the glucose level is high in the body, it can cause damage called end organ damage to your eyes, to your kidneys, where you cannot even see sometimes, and your kidneys can, nerves, and your kidneys can go into nephropathy and requiring dialysis sometimes. Compared to that we know for sure because we have long-term data. If you're not able to bring down your glucose level with the existing medications, I think this is a very reasonable approach.
A risk-benefit payoff.
Correct. Risk-benefit payoff.
Right. Okay. And do you have any stories that you think, are extremes where you had really good, like a second lease of life, or where another extreme where you think it was an absolute bad idea?
So I'll tell you a story. I think this is a very important story that every listener should understand. He was borderline diabetic, pre-diabetic. Okay, so he was around 220 pounds, around like 100 kilos. Okay, he has been trying to do lifestyle medicine for the last like 6 months. He wanted to go on diet, exercise. He was not able to prioritize in his life. Okay, and then he gave up everything and then he started prioritizing. But unfortunately, his metabolic rate was very low that no matter what he did, he was not able to make any changes. And he came to me and he said that I'm very, very frustrated, disappointed with the whole thing. I'm depressed that no matter what I do, my weight is not budging down at all. So then we said that, okay, so we will do a sandwich therapy. We call it a sandwich therapy, where first 1 month we will do an intense lifestyle modification, where we target 6 pillars of health, which is your fasting, your sleep, your hydration, your stress reduction, and your diet and your physical activity. So then we put together a plan for him, individualized for a month, where he just has to step up a little bit compared to what he was doing before. Then we put him on Mounjaro, 2.5 milligrams, didn't do anything. Again 2.5 milligrams, didn't do anything. 5 milligrams when we increased, he started having mild symptoms. I said, beautiful, perfect. So I think This is where the dosage is, and you are able to tolerate the symptoms a little bit. So no, but you shouldn't stop doing the simultaneous lifestyle thing. So sandwich is first lifestyle, then Mounjaro plus lifestyle. So we continued for 3 months, and he lost around 18 kilos. Okay, around like 4 to 6 months, something like that. His A1C came down to almost normal, and he was so good in his new body. Okay, because he didn't lose muscle, because exercise was there, protein requirement was there, and now we took him off of Mounjaro, and he is continuing the lifestyle medicine forever, and he has been doing this for the last like 6 months, and he has never ever gained the weight back again. And because during this course you also need to understand that you should build new neurons in your brain to create these habits to take you for a longer run. That is why quick fix will not work. So Mounjaro alone will not create those new neurons. So Mounjaro plus this lifestyle modification will create the new neurons. And once we know that the new neurons are built based on the habits that you are doing, we can take Mounjaro off and then continue it. And that guy is in such a good phase of life. That is a very, very successful story that I always tell my patient is that
Part of a toolkit.
part of a toolkit, correct.
The biggest factor here that makes a difference is the connect that you and he together made, or your team and he together made, to say that I will have a better way to look after myself, and this was part of the toolkit.
Correct. It is a part of it, and it is not the only toolkit.
Right.
And it should not be the only toolkit.
Only thing. And what's the bad side?
Bad story is, many patients will not be able to tolerate the side effects. Some patients have severe bloating. Before starting the medication, you need to be on a very nice diet for at least for 1 or 2 days, because you cannot have a chicken biryani and then have this diet. Then chicken biryani will not digest for 2 or 3 days. So you need to be very careful along those angles as well. So this patient had very severe bloating and cramps, and they were not able to handle it. Then I said that, it's okay, which means that you have to intensify your lifestyle modification, take your notch to the next level.
Maybe 2 months instead of 1 month, where they take the time to come.
Take the
into
time to come,
system.
exactly.
So allow them the
Correct.
the space to really understand that this is what the commit. And the 2 months is what they're likely going to have to follow.
Correct.
Right? Even after getting off. So then maybe that pact that they make, that connections that they make, the learning will help them ease better. Is it a dose dependent issue, or is it more like an idiosyncratic issue? For example, the
No,
side
it's dose
effects?
dependent.
Okay.
It's very dose dependent. Sometimes, it is like 2.5 milligrams. Some patients will be like really sensitive. But usually it happens is that when you increase the doses where we see the symptoms. And the other issue is when you have only Mounjaro and you continue that, let's say like 3 months, 6 months, and your weight is going down. Similar to how Mounjaro is taking its own time to decrease the weight, the lifestyle modification will be double the amount of time that the Mounjaro takes. So we call this as neuroplasticity, where you can actually build new neurons in the brain within a span of 2 to 3 months with repetition. And that is something that people should understand. That is the only way to create lifelong habit change, and Mounjaro can be used as a toolkit.
Who will you not give this drug to ever?
Patient who will not willing to do this lifestyle medicine. Actually, that is unethical. For example, I always feel like, any field, I'll take your field itself, okay? In dermatology. You cannot tell a patient that, this is only my opinion. I don't think.
I'm waiting.
You cannot tell a patient that, you come for all this microneedling, RF and everything, but at the same time, your sleep can be compromised.
You smoke.
You
You
smoke.
won't wear sunscreen.
You don't wear sunscreen. You drink alcohol. And you're in a very stressful environment. And but the microneedling is like 10,000 rupees. You come and get it. I feel it is unethical. The same thing is for Mounjaro practice as well. Just because it is easily available and a patient walking into the clinic and you are just prescribing it, it is absolutely unethical if you don't have a plan to take this poor patient off of Mounjaro. That is absolutely, in my opinion, it is criminal.
Yeah, I agree with you. I think sometimes these are, when you look at someone and you think that they're not going to commit to a good self-care protocol, people get angry when we say that we will wait for you to, kind of start showing to us that you are really serious about what outcomes you want. Now, I'd like to see your response first before I think we can build out the treatment plan. People even sometimes get angry. Just give me the procedure. Just start it off. Now, what reservations do you have? But I think it's important to stand the ground and say, I do not want this because I just don't think it'll work for you. More importantly, it's also about understanding that no can make a big difference later on when things don't go well. It's always important to be able to exercise that right to refuse certain people because they are just not ready in their journey yet.
Correct.
But we create the circumstances for them to be more aware. Maybe that's a 1 month instead of 2 months. 2 months instead of 1 month, and maybe even 3 months, because you want to make sure that the results are compounding and you utilize this nice tool in a way that it serves the end goal. Yeah.
Correct.
If we say 90 minutes before bedtime is when we should ideally try to shut down, what is the dinner time? What is the time that the last meal should be for the day to have good sleep? Say, for example, without reflux.
Right. So I have said this multiple times in the main channel as well, where the ideal time of dinner is 7 p.m.
Okay.
7 p.m. dinner, 10 p.m. going to sleep, waking up at 6 a.m. You will not have to see a doctor. But the thing is, you need to do this on a daily basis for 1 year.
For 1 whole year.
If somebody does for 1 whole year, I guarantee you that they don't have to see a doctor ever. But it needs to be 1 whole year, every day.
That's a good New Year resolution. It's an impossible New Year resolution.
Every day. But at least you can achieve like 50 to 70% of it. Right. I tell my patients to target weekly. So in the weekly, at least 5 to 6 days, you will have to have a constant routine as much as possible, at least 5 to 6 days. So the reason is it takes 3 hours for the digestive process to die down. It is all interconnected. It is not like we are making this up, right? So the digestive process needs to come down. Then melatonin should have to be peaked up. Then your brain needs to rest so that it can recover the next day to digest again. So that time is extremely critical. So that's why I say 7 p.m. dinner, 10 p.m. sleep, from 9 to 10, no phones, no electronic devices, nothing. And if you're a couple, that is the best time to have a conversation without any arguments.
Or just go to sleep quietly.
That is very, very critical. You should not have an argumentative conversation before you go to sleep. Because again, the activity is what we're talking about, the neuro impulses, because you are going into an emotion of, anger, frustration.
Instead, just see your phone. No.
So that is something that I always strongly believe in. And, with this busy modern world, right, that might be the only time that you may even get
to connect. Yes.
Get to connect, right? So no, I always believe in this, that, your kids will leave, your parents will leave, the only person that is with you is your spouse. You have to put that effort to make that work. And if you don't put the effort, it will not work. It will definitely not work. So I strongly believe in that. And we, for example, me and Priya, we have a routine. And we have always stuck to this, and it has worked for us. Similar to that, many people have to figure out, okay, when is your dinner time? What time am I going to sleep? What is your plan? So that will need a lot of planning.
The cadence is very different for different couples. That's definitely
Right.
there. True. Also, it's a privilege to actually think about having a fixed cycle like this, because at this point in time, where many careers are based out of, like they have a US-based time schedule, or they a different schedule where people have to work night shifts, to be able to even plan your day in a particular cadence is a privilege at this point in time. There are folks that they know that
Right.
that is not good for them, but they don't
Right.
have a choice.
Right, I know you're right. But for in that situation, my suggestion is that person shouldn't say that, oh, this is my job and that is why I'm doing this, so I don't have any other option. You do have an option. You remember we talked about the 6 pillars. One of the pillar is sleep. All right. So when you are compromising on that, you're working on your time, you need to make sure that you are maximizing on all your other 5 pillars. You cannot take that light. You cannot eat chicken biryani at night while you are working at night. Right? So you need to have that kind of a discipline. So the reason that many things doesn't work is because people are not willing to push themselves out of the comfort zone. They want to have the job, there because it is nicely paying and it's a very good career growth, which I completely agree.
It's important.
It's very important as well. But you need to understand you're compromising your health while choosing that option. For that compromise, you need to make it up in terms of somewhere else.
Right.
You cannot do both.
I think there's a undeclared war, or that's the mentality that you have when you speak about chicken biryani. Where is this starting from? What exactly does biryani do to us?
No, biryani, I think it's an overhyped food, in my opinion. Is because, same flavor can be achieved in many other foods as well. But maybe biryani is a little bit more emotionally connected. And we feel the social media as well, we have kept on talking about, okay, if you have stress, eat biryani, it'll go away.
Biryani is an emotion.
Biryani is emotion. If you're happy, but the problem is the amount. You should see how much amount of biryani that people are giving now just to attract customers, right? So
it's always been half a plate, full plate. Like the metrics of biryani has always been like on the larger side, right?
Correct, larger side. Let's say that you are stressed out and you are having a plate of biryani, right? There is nothing wrong in that. It's completely okay. But what happens most of the times the next day? The next day, nobody is going to jump and then says, okay, so today I'm going to eat salad because yesterday I had biryani. That doesn't happen that frequently. That is the problem. Once you go that route, most of the times it is a slippery slope. Most of the times you will end up having junk again the next day, even without your knowledge. So that is where that you will have to enforce a little bit of a discipline in terms of, okay, see, I'm going to have biryani, but only this much. That's why I put a reel. I went to the biryani shop. I said, split this into half. Take this now and take this as a to-go box and you eat it later. The restaurant guy didn't allow me next time into it.
Of course. I don't know if there's a win-win with biryani that way. So does biryani have an allowance in your New Me program ever? Does it find a place, say maybe once a year or once a month, or is it a never?
So New Me weight loss program, what we do is that we want biryani in their logs.
Okay.
We want ice cream in the logs. We want your pizza, your French fries.
Highly reassuring.
In the logs. Because I strongly feel that is the only way that you can achieve a sustainable weight loss. So the point that we are trying to get across is not that don't eat biryani. Eat biryani in a conscious way is the point that we're trying to get across. For example, so let's say you have one plate of biryani, you should know that, okay, this is 1000 calories. This is no fiber, lots of ghee, lots of oil. Okay, so but I am doing this because I like to do it. Because I feel like I need to eat today. It's completely okay. So the teaching that we used to do in the program is that, okay, so you have 1000 calories. You can have only 1800 calories to achieve the goal that what you want. You're already 3000 calories for this day. So we will teach you in terms of how do we cut down to 1200 calories the next day and then 1200 next day, so that in the week you'll be able to compensate for the pleasure that you had. It is just a balance between pain and pleasure. Alright, so it is always a seesaw. It cannot be always pleasure all the time. The problem with right now is there are 4 different kinds of things that is happening. Availability, accessibility, potency, novelty.
Tell us more.
For example, in this corporate world, they have figured out all these 4 things beautifully. Accessibility, Amazon delivery, Swiggy delivery right away, right? So you don't even have to think about how to buy and everything. Availability is just throughout every hospital, right next to it, there is a food. If you don't, I'm not even kidding, you go and see Chennai. Every hospital, there is a restaurant. Next to the hospital, there's a restaurant.
Maybe the hospital canteen sucks. I don't know.
And then one row, there's like so much biryani centers, right? So availability is so much. But at least before, somebody needs to go there and then eat, and then they'll be truly considered as a weekend pleasure. Now, accessibility is Swiggy delivers within you in 30 seconds. They are competing between Zomato and Swiggy in terms of who is going to deliver faster. The third is potency. The potency is these corporate guys have created the product, whether it could be biryani or it could be something else, so potent and highly addictive that you keep coming back. Okay, so only then their business will sustain. There's nothing wrong with them. They're also starting to sell a business model so that they survive. The last one is novelty. And that is where your KFC cheesa comes into play. Do you know what cheesa is?
Yeah.
Chiza, Chizza. Okay,
Pizza with too much cheese.
that's what I thought. It is not even that. Chicken in a pizza. It's only chicken.
Right.
It's chicken in a pizza format and it's deep fried. A processed meat and the deep fried both increases the risk of trans fats. Trans fats increases the risk of heart attack. It is everybody knows that it is not good for you, right? But the novelty, when I say cheese, oh, let's go and try cheese, right? And the social media food vloggers are making it to the next level in terms of getting the highest camera focusing on the food. They stimulate the digestive phase of the system just by watching it, right? Because visual stimulation, and that creates salivary juices right away. So that is novelty, accessibility, availability, potency, novelty. These are the four things that is making the environment so difficult to sustain a good weight loss journey. So that is what we say. We cannot fight against these four. So in our New Me weight loss program, what we do is we teach you that, okay, these are all the things that is going to happen with you. You will have to equip yourself with the bandwidth that you have to manage this kind of an attack. For example, in one of our clients will always have biryani or pizza once a week or something like that, but they will be able to manage the calorie, fiber, protein content for that particular week according to that pleasure.
I see this a lot. I see a very similar parallel even in skincare. We have these really ridiculous products like hair locator spray. If you can't see the hair, then you can't locate it. So it's okay. We have something called a hair locator spray. Apparently, it makes makeup sit better, but it has a lot of potent, really toxic stuff in an aerosol way. Like even if you thought that, okay, maybe if we will put it on in a different way, but the aerosol, it lands straight where you don't want it to land. And this is something that goes viral once in a while because it's novel.
Correct.
Otherwise, you wouldn't think like who would want to locate the hair that you can't see. So I find this to be fairly very common that novelty is important. I think novelty is something that human evolution has always paid attention to. And I think it's a very, very important thing. For example, if our teachers did not find novel ways to teach us the concepts better, it wouldn't have been as engaging. So while I find this is so important, it can be used in a completely different way. So what novel techniques are you using in New Me?
So New Me is very special to me, and I'll tell you my story. So I was pretty big before, 100 kilos, and I tried everything, right? So I spent like 2 years just to research in terms of like, what is intermittent fasting, what is keto diet, what is nutrition, what is protein, fat, carb. I didn't even know that at that point of time. So I spent 2 years and I knew everything at that point of time. Okay, so I know exactly what needs to be done, but I was not able to do it. Okay, so at that point of time, in my Dignity Health hospitals in California, they offered something called a life coach program. Okay, this is for free, 6 weeks. Once a week, you get to talk to that life coach, 30 minutes a week. Okay, they said for that 1 month charge is $800. 30 minutes. It's only $200. And I said, I'm not going to sign up for $800. What nonsense is this? Then they said that, okay, 6 weeks, it's free. And I said, okay, it's free only. No, I'll sign up, including my wife. They said, no, wife is not available. Why because you are the employee. So I went, right? So the first thing, he didn't even ask me anything, okay? He just kept on listening for 30 minutes. Okay, what is your goal? That's it. So I kept on saying, I need to lose weight. I know this. I know I need to fast. I need to do this. I need to do that. I need to do all these things.
Therapy for weight loss.
I'll keep talking about 20 minutes. And then he said that, okay, so you spoke about all this. Looks like you know everything what needs to be done. So the problem is the execution. Okay, so for the execution part, there is no way that you're going to do all these things that you told me about. I figured out that there are 6 pillars that you need for weight loss. One is fasting. Second is sleep. Third is, we call it stress reduction, MBSR, mindfulness-based stress reduction techniques, MBSR. Fourth is hydration. Fifth is diet. Sixth is physical activity. Remember, I told the fifth, diet and physical activity, only fifth and sixth foundation. Because if you don't have the other 4 things as a strong foundation, no matter how much diet or exercise you do, the outcome will be blunted. So I told all this to him. He was very surprised that you have so much knowledge. And why are you still obese, right? So then he said, okay, so you need to do all these things. So let's just do one by one. Okay, so the first thing that we worked on was the fasting time window. So we said, okay, so right now we are going to focus only on your dinner time for the next week. So every day at dinner time, there will be a text that comes up from him. So he will say, in 1 hour, you need to wrap up your dinner. And then initially, first 2-3 days, I just ignored it as usual. And then the fourth day, I was expecting the text. So he didn't text me. Fifth day, he didn't text me. And then one day before the call, I did it by myself because I know that in that call, he's going to ask me. That was an eye opener for me.
Accountability.
Accountability was like, wow, it was mind blowing. Even because I was not accountable to anybody. I was the boss in my department. And except for my wife, I'm not accountable to anybody. Right, then I realized that this is creating something in me that I am scared of the call that is going to come up, and I need to show myself. It was really bad that somebody has texted me and I didn't reply back. So that started with that eating window. So from 9 p.m. we were able to bring it down to like 7:30, but this took time. Okay, so 3-4 weeks we just focused only on this. Okay, but every week for 30 minutes he will listen to all my stories. But finally, he'll speak only for 5 minutes, and then he will say that okay. So this week we called it as champagne moment. Champagne moment means in that week every day you need to hit this. That's it. Don't worry about exercise. Don't worry about nothing. Dinner time. That's it. This is the only time. So every day champagne moment, there'll be a progress card, and we keep on checking, and then we are looking for the next weekly call. So after the 4 weeks is done, my routine got so streamlined that I knew that I developed the new neurons for that particular pillar alone. So then next we went to sleep. So this kept on going, right? So it was 6 weeks. The trial period is over. And I got hooked to this. So I didn't have a choice. That I paid $800. My mom will kick me. You're spending $800 for this. I mean, it was so expensive, right? So, but you know, I know that this worked. So then from then fasting, then we worked the sleep. Then the most important thing was meditation. It just took me to the next level. And one of the main reasons that I'm able to do so many verticals is because I have increased my mental bandwidth to handle this. I'm not a Superman or anything. I have worked on this for the last 5 years to improve my bandwidth to handle all these verticals. That is what the true thing is. And even from meditation, how this works is, you know, like they say, we'll start with 2 minutes per day, 10 minutes per day, 20 minutes per day, and then eventually it ended up being 1 hour per day. I do 1 hour of meditation per day. Can you imagine? Even now, 20 minutes in the morning, 20 minutes in the evening, and 20 minutes at night, no matter where I am. That is how deep the habit formation was during that coaching program. Okay, and it took me forever, and you will not believe I'm still paying that money. I still have the life coach. Because that accountability is something that everybody needs. Okay, and in your business world, you know that there is a business coach. When you have a business coach for a business which is just a part of your life, the life is your entire business. So we claim this as a life coach. So after meditation, then we went to hydration, then we went to diet. In the diet, we went into protein, fiber, carbs, macros. As a matter of fact, he was not an expert in any of this. I was expert. I used to tell him what needs to be done.
He'll just help you get it done.
He was a mirror. He was a mirror to my life. Basically, I looked at him. My life was just reflecting on him. I could clearly see, okay, this is the problem. I could figure out that I had more time by looking at him and talking to him those 30 minutes. And you know, I cannot, and he checks on me on a daily basis. He doesn't give me a WhatsApp number. I need to record a voice note and then send this an email attachment to him, and he will check at his convenient time. Right? So, but even then, that little bit of outside comfort zone made me disciplined. And so then I lost all this weight only during that 1 year. So then the beauty is that I have never put on that weight back again, because it was a long-term fix that I know that my neuroplasticity is set.
Without Ozempic or Mounjaro.
Without Ozempic, without Mounjaro, nothing. So then I realized that this is a wonderful thing that we are missing in mainstream medicine. In mainstream medicine, while you're doing gastroenterology, when somebody coming with abdominal pain, what we do, we know that this guy is stressed out. His brain-gut axis is not working. We do an endoscopy, we do a colonoscopy, we take CT scans, and we say that, Thambi, there is nothing wrong with you.
Both the scopes meet in the middle.
More in the middle. And then we say there's nothing wrong with you. You go and fix your lifestyle, right? I felt like there was something missing. I acted like a plumber. and I say, okay, do all this, okay, there's nothing wrong with you. I felt like there was no meaning to the job that I was doing. Then I started doing all these things within my program in my hospital, and we put this term called preventive gastroenterology department. And the problem with that is insurance did not cover any of this at all. Insurance covers only procedures. If I do an endoscopy, the hospital gets $5,000. The hospital gets. The doctor gets only like 60 or 70. The hospital gets. But let's say that I spend 1 hour with a patient explaining about all these other things to be done. The hospital gets only $250 to $300. It's 10 times less. So the insurance were not able to. Hospitals were not ready to approve. There's one chair of the hospital was very. I'm very glad that he was able to find the benefit out of all this. And then he said that, okay, so this is what you want to do, you do it. So then I became a director of preventive gastroenterology. I lobbied for the hospital coverage, and finally we got it covered for all my patients, right? Only my patients alone. So then a patient comes to diabetes. Now they come to me first. We optimize the gut health, then they start on medications. So preventive gastroenterology is something that we put together. Then we realized that how can I spread this to all over the world, to all my subscribers basically, because they kept on asking me, what is the weight loss thing that we can do? I said, this is the secret sauce. So you need a person who can be accountable on a daily basis, and that person should be an expert who needs to know all the 6 pillars, and that person needs to be patient, be empathetic, and you need to reflect your life with that patient. This is a journey for 90 days. So then we came up with this program called New Me, where you come as old you, we'll give you as new me, where we'll be assigning, I'll be evaluating the medical history. We'll figure out a plan for 90 days. And that life coach, who's a clone of me, where we train them intensively for 3 months, because my name is on the page. I need to make sure that the trust is being delivered. So that person is a clone of mine who delivers the exact same amount of care what I will do with the patient. That requires a lot of effort and trust, and we have put that together. So 3-month program, they pass, then they get the client, and then this is a 90-day journey. We have all the things that we talked about, virtual gym, behavioral therapist, sleep specialist, psychotherapist, and we have a nutritionist, and we have a yoga therapist. We have everything. It's like a one-stop shop where you come in, we take care of you as a whole. But the key thing is take care of you as a whole according to your individualized lifestyle at that point of time. So just because there is yoga, just because there is Zumba doesn't mean that you are going to do yoga Zumba on a daily basis. So you will use that life coach to adjust your schedule accordingly, and that daily nudge from the life coach will be the repetition factor that you need to build the neuroplasticity. So we started with weight loss initially. Then we started with 25 patients, then 100 patients. Now we have 1,000 patients online per month. And we don't go for quantity, we go only for quality. So every life coach cannot have more than 20 patients. So you only have 50 life coaches, we only have 20 patients per life coach, we have 1,000 patients. So we have told them that the results are more important than the number. So you will have to really see whether there is a good match. This is like a marriage between the client and the life coach. It needs to work. And we have like quality control thing, making sure that everything is okay. So with God's blessings, I think it's going well. My 2 cents is that this system should be there in each and every hospital. I mean, not necessarily New Me, but this kind of a lifestyle medicine clinic. And mainstream medicine is recognizing this as one of the curriculum these days. Similar to internal medicine, after that gastroenterology, there is a specialized curriculum called lifestyle medicine, where they feel that if the lifestyle is not being fixed, all the medications are just a band-aid. So medications plus lifestyle medicine is the target. So that is what I'm doing with New Me. It's a long answer, but that's the answer. The most important mistake that even adults are doing is before going to bed, when we are watching reels, everybody should have a timer of how much amount of social media you're using per day.
So who are you as a person?
I'm a person who uses humor as a weapon to protect myself. Many subscribers have told me that, when I look at gulab jamun, I see your face on the gulab jamun. The husband comes home late at night and then looks for dinner. There is no dinner on the table. He opens the refrigerator. In the refrigerator, there is a picture of mine and it says no food after 7 p.m.
You got your entire family to act in some of your pieces.
Right. I am willing to be the bad guy.